So, what are the mistakes that most people are doing or making to destroy their kidneys? That's what we're going to be talking about right now. What are some of the mistakes that people are engaged in, leading to their kidneys being destroyed? And before we go on, I just want to show some slides that I've made. I'm going to have to go all the way to the beginning so that we can see from where I want to start from. But the kidney is a very delicate organ that can easily be destroyed. And you don't want to destroy it if you don't have to. Well, who has to? Who wants to destroy their kidneys? Some people, through no fault of theirs, have ended up destroying their kidneys. And today we want to make sure that we learn and avoid destroying our kidneys, whether or not you have diabetes or hypertension. But these two important disease or chronic disease states are very essential when it comes to kidney health. And so we're talking about 5 deadly mistakes that lead to kidney destruction. 5 deadly mistakes. And we're going to be going on along with my slides that I've made to make it easier and more understandable. So let's move on right forward. All right. So the kidney disease is a silent crisis that is going on in our communities. We have a lot of people, whether you are in the African American community, or you are in the diaspora community, or you are in a place like India or Asia, most of the places outside the West, people have silent issues going on with their kidneys. But what makes it even worse, as I alluded to, is diabetes and hypertension, which mostly is also found in these communities that we are talking about. So people with high blood pressure, people with diabetes are experiencing kidney health issues more rapidly. And as we go forward, we will understand. So that is something that we have to keep in place. Now, the first mistake that we do, or the first kidney mistake, or the first mistake that leads to our kidneys being destroyed, is uncontrolled blood sugar. If you have blood sugar levels that are not controlled, then you are definitely putting your kidneys at risk. That is exactly what we want to prevent. So if you see this image that I'm showing, this is like a filter in the kidney that we call the glomeruli. And this filter has been crystallized or basically shot with sugar. Too much sugar roaming around in your blood lead to destruction of this glomeruli or this filter mechanisms or filtration cells in your kidneys. And so if you don't control your blood sugar levels, some people may say, well, I don't have diabetes, so why should I be concerned? You may not have diabetes, but if occasionally your sugars are spiking, what we call hyperglycemia, or potentially you are even in a state where we call pre-diabetes, you may be incurring slow damage to your kidneys, your filtration system. And when that happens, you are going to end up with eventual kidney disease issues. And so it's not just the people who are diabetic, but people who occasionally, more frequently, get episodes of high blood sugar are at risk. So that is mistake number 1. If you don't control your blood sugar, you are making the mistake of making your kidneys shut or destroying your kidneys eventually. And if you have diabetes, it's even more important because the risk of blood sugar going up in your blood is higher because already that's a problem or an issue that you're dealing with. And so if you do not take care, you are going to eventually have an issue with your kidneys. So that is something that we need to definitely take into perspective as we move forward. So the first mistake that we're talking about that leads to kidney destruction or kidney damage is uncontrolled blood sugar. Uncontrolled blood sugar levels. If you have diabetes, there's a way for you to control them. But if you leave it and think like, that's just all you got, you are eventually going to touch your kidneys. And so it's not just the blood sugar levels that we're dealing with. You are going to be dealing with what we call diabetic nephropathy or kidney destruction due to consistently elevated or consistently high blood sugar levels. Now, the sugar damage continues, as I said, with chronic spikes in sugar levels. The slide that I showed earlier was just showing you a destruction in terms of your filters, what we call glomerulus or glomeruli. Now, in this image right here, I'm showing yet another destruction that is going on due to uh, chronic glucose spikes and leads to scarring. There's a scar tissue begins to form in your kidneys. And with the scar tissue being formed, what then happens is that eventually your kidneys are going to fail. You don't need scarring in your kidneys, in your filters, or in any place in your kidneys. And so the more scarring continues, you can bet that you are destroying your kidneys for that matter. And the scarring can also lead to what we call protein leakage or protein urea. You begin to pee proteins. When you pee, when you go to urinate, proteins are going to eventually show in your kidney. In your urine. You may not see it with your eyes, but when you see foam, excessive foam formation in your urine, you pee, and there's so much foam. A little bit of foam is okay, but if you have foam to the extent of somebody drinking and pouring a BAC, all that foam, that is a sign that your kidneys are being damaged, and that is all a sign of protein in your urine, which is not a good thing. So that is another thing that happens when that damage continues with glucose spikes. The other thing is that the diabetes and kidney connection is alarming. It is something that is known, and up to about 40% of people who have diabetes would eventually have kidney disease. Up to about 40, close to even half of the people who have diabetes are people who are going to have, kidney issues. And so if you are diabetic, or if you have been told you are pre-diabetic, you should lose weight, you should eat right, you should exercise and get your sugars down, you must take it as seriously as possible, because if you don't, you have 40% chance of destroying your kidneys as a result of the diabetes by itself. And so you get diabetes leading to, again, kidney issues, as we have said. And so it is not a joke. You've got to take care of your blood sugar levels and ensure that you are not destroying your kidneys. Now, before I go to the next slide, which is the next mistake, we also want to say that what do we do about this? How do you control your blood sugar? How do you, we can use this stream to discuss everything, except to say that if you have diabetes, you have to try and meet the goals that your doctor may have set for you. We all know that having an A1C or hemoglobin A1C level of less than 7 is the way to go. If you can bring it even further to 5, that's even better. But anything less than 7, 6.8, 6.5, you would be doing something good. And how do you find out this number? 3-month check, lab work that your doctor does. There are also some devices that you can buy and do this test on your own. Not that common in many places, but I know in the US you may find that on the shelf. But basically, if you have a caretaker, if you have a doctor, they can do this check every 3 months and find out how your A1C levels are. If your A1C levels are less than 7, then you're protecting your kidneys. But if you are consistently higher than 7, you know your blood sugar is not being controlled. And if it's not being controlled, then of course you are getting your kidneys in trouble. Remember, 40% of people who have diabetes will end up with kidney disease. You don't want to be included in that 40% of people. And so aim for A1C of less than 7. And the way you know you are keeping an eye on it is be checking it all the time. If you don't check, you don't know. If you don't know, you're going to screw it up. So make sure that you are checking and you're looking for it all the time so that you do not end up with that problem. or with diabetes destroying your kidneys. And sometimes some people too may have to just stick to what your doctor say. But for some people, your doctor may say that, hey, I just want you to be at less than 5%. So if I say less than 7, don't just begin to increase your sugar intake and say that, well, I'm close to 5, so I guess I'm good. No, go by what the doctor says. For some people too, your A1C levels are already around 8 or 9. And so your goal in the immediate future maybe just drop it by 1. It doesn't mean when you reach 8, you're all done. Or your goal may be to drop it by 2 points to come to 7. But when you reach 7, you don't stop. The normal is always less than, in some places it's less than 6.5, but at least less than 7 is a ballpark number that you want to, at least. If you can't do anything beyond that, then it's not good. You got to make sure that your A1C levels are less than 7. And also, if your doctor wants it to be even less, which most people can do, then stick to what the doctor has told you to make it be. For example, it may be you've been told to make it less than 6, or you hit the 6 goal and you've been told to do less than 5. Keep at it. The lower, the better. The lower, the better. So it may be personalized, maybe individualized to you and to your case. For some people, you've been told that if you bring your A1C to less than 6, you're going to be taken off of insulin. Do it, because that's the specific goal that your doctor has set for you. But obviously, keep an eye on that number and work towards it, because that's how you know that you are doing right. All right, so now let's move on to the next mistake that a lot of people make, which is mistake number 2. Mistake number 2 is ignoring your blood pressure. A lot of people have ignored their blood pressure. Granted, blood pressure does not cause pain. The high blood pressure does not cause anything. For a few people may see headaches here and there, but even that's when it is extremely high. But if it's tipping around 150, 140, 160, you may not even feel anything. So for some people, even 180, they won't feel anything. And so don't take it like, oh, when my pressure is high, I feel headache. So that's when I know my pressure is high. No, it's not like that. It doesn't give any sign. And if you ignore your blood pressure, you are ignoring your kidney health. It means that you are potentially going to destroy your kidneys and end up with kidney damage earlier than it should be, in terms of your age. And so, if you have been told that you have blood pressure issues, or you have high blood pressure, or what we call hypertension, obviously make sure you keep an eye on your blood pressure, because it's not just for your heart health, it is also for your kidney health. As a matter of fact, even it's for your sight. It affects a lot of other important organs. And so make sure that your blood pressure is always on point. High blood pressure is the second most common cause of kidney disease or kidney damage or kidney failure in a diabetic patient also. And if you have been watching us long enough, we have linked how increased risk of hypertension is to people who already have diabetes. So they walk hand in hand. So if you have diabetes, it's most likely you are going to have high blood pressure because of the sugar damage in your artery walls, right? The sugar damage causes your artery walls to be stiff, and the stiffer they become, the less dilating or the less relaxed they will be, and for that matter, the higher the pressure, because your heart is pumping against a higher pressure. And so you don't want that to happen. So it happens hand in hand. In other words, if you have diabetes, most likely you're going to have high blood pressure, but it doesn't have to be. They go hand in hand, but you can stop it from happening. And if you have diabetes and you have high blood pressure on top, and both are not contained, or both are not managed right, there's a likelihood that you are going to destroy your kidneys as a result, and faster. Because remember, 40% of people with diabetes are going to destroy their kidneys. On top of it, if you have hypertension, it makes it even more serious. So make sure that you do not ignore your blood pressure, whether or not you have diabetes, because by itself alone, high blood pressure, not controlled, can lead to kidney disease. Apart from heart disease that most people know, it can also lead to kidney disease. In fact, it can lead to other organ damage around the body, everywhere. And so, just to be concise and precise, we want to make sure that if you have hypertension, make sure that you are dealing with it. Don't ignore it. Don't think you don't feel it, so you won't take your medication. Don't think anything like that. Make sure that you keep an eye on it, because not doing so is likely going to end up destroying your kidneys before you know it. Before you know it, apart from the damage on your heart, apart from the potential for a stroke, apart from the potential for other disease states, you can cause a kidney damage. You have people on dialysis, people who have were on a waiting list for kidney transplant, and all that happened was uncontrolled hypertension or blood pressure. And so, do not ignore your blood pressure. So that is mistake number two that people have been doing, is they have been ignoring their blood pressure. They have been ignoring their blood pressure. So let's move on. What is the next one? The next thing that we want to talk about is there is inequality of kidney disease. When we talk about blood pressure, we talk about diabetes, these disease states have been noted to be more in communities of African descent. If you are dark skinned, it doesn't matter where you are from, whether you are from the US or from Africa or from the Caribbean or from India, we have seen it is linked, it is noted, it is readily available, it's a knowledge out there. Because of our genetics, we have higher incidence of high blood pressure. We have higher incidence of high blood pressure, which predisposes us, therefore, to higher incidence of kidney diseases. And so it is not something to play with. It is not something to play with at all. Because of that state, it also predisposes us to more kidney diseases. And so if you took a population of the US, you have more black people with kidney diseases than white people, because we are getting high blood pressure more. So it's a health disparity. Black adults are 3 times more likely to develop kidney failure than white adults. It's a matter of fact, and you can't do anything about it. But you don't want to be part of the statistic. The only way you can avoid it is to make sure that you keep an eye on your blood pressure. If your blood pressure is consistently high, you are trying to include yourself in that statistic. If we all pay attention to our blood pressure levels, we might be able to potentially avoid being at this risk of kidney damage. But most of us just get the diagnosis. We don't take our medications because you don't feel any pain. You don't feel like the urgency of remembering to do your medication because there's no pain. If it was a painful thing, you would definitely remember, because you need to take that medicine to destroy the pain. But because you don't feel any pain, you just forget. I didn't remember. I didn't do this. And you're not doing the other things that you need to be doing, such as eating right and exercising and all those things. And so if you do not do those things, you are setting up yourself and your kidneys for eventual damage. And on top of that, if you have blood sugar issues, as we alluded to, it becomes even worse, because now it's 2 things working against you. And so we definitely need to pay attention to our blood pressures and ensure that we do not end up in any such a problem. Now, let's go to the other. I think there's another thing that we can talk about here. So, the action plan for our blood pressure issues. What I would say is that to look for a goal. Again, it may be specific to your case. If you have if you have had long-standing hypertension over the years, your doctor may set a goal for you as 140, less than 140 over 90. Less than 90, less than 140. That may be the goal that the doctor has set for you. Just because you've had it for so long and they're just trying to keep it, somewhat safe. But apart from that, the real good goal, or better yet, the goal that a diabetic should have should be less than 130 over 80. Less than 130 over less than 80. That is where you want your blood pressure to be. Now, again, if your clinician, if your doctor thinks that, because it was so high for you, you were in the 180s, you were in the 160s, and he or she is good with you becoming less than 140, and it's okay. And also, due to individual difference, for some people, when it comes down so much to less than 130, they cannot do other things. And so it's understandable if your doctor says that, hey, keep it at less than 140. That is if your doctor says so. Apart from that, all of us have to aim for less than 130 over less than 80, which is not easy to achieve, especially if you are grown, if you have a family history of hypertension, if you have issues that predisposes you to hypertension. It is not easy to drop it all the way to 130. So it's understandable, but you got to know that wherever you are, you can do better. So don't be like, you know, like all satisfied with where you are, in spite of what the goals are. Don't think that, hey, my doctor says if I can do 160 or 150, I'm good. I know a lot of people are looking to do less than 150. If you have hit that goal, talk to your doctor and see if you can even bring it down some, because you are not there yet. And if we are serious about going down the more, we can achieve it. It's just a matter of determination, and all the other things that we do. Losing weight and eating less salt. I don't know if I have it on my slide here, but definitely is something that we can do and ensure that we come down as far as the blood pressure is concerned. All right, so let's go on. So let's go to mistake number 3. Remember, we're doing 5 mistakes that people do and destroy their kidneys. Mistake number 3 is too much salt and processed foods. Mistake number 3 is eating too much salt and too much processed foods. Too much salt and too much processed foods. Excess sodium increases blood pressure and kidney workload. So this is why our blood pressures are high, and that's how we are destroying our kidneys. So that is a mistake that most people make. We have a sweet tongue, or should I say we have a salty tongue. Well, some people have both sweet and salty tongues. They want something that is full of sugar, and when they are eating something that is not with sugar, they want all the salt that they can have. So sweet and salty tongue is leading a lot of people into problems. So that's a big mistake that our community is doing. Too much salt itself, the direct addition of salt into food, and then also the over dependence on processed foods. We eat a lot of processed foods. A lot of people do eat a lot of processed foods. A lot of processed foods. I can tell you that, from these processed meats to canned foods to almost everything that we eat has been touched by somebody. Literally, that is what we mean by processed foods. Everything, everything that we eat has been touched by somebody. It's either corned beef, so salty, or some other processed food in a can. We have to preserve it with salt. And so you may say that I'm not eating salt, I don't eat salt, but all the foods you're eating have been processed. There's no fresh, untouched food. Everything you eat has been touched by somebody. And for them to be able to preserve it, there's got to be salt. I know there are some other preservatives that are put in food, but the bulk of preservatives is salt, because salt is not a poison, I should say. Because of that, most preservatives come with salt. And so you may not be directly eating salt, like we say you're eating the salt shaker or you're adding salt to your soup. You may not be doing that. But if you're eating canned foods, if you're eating from the fast food joint, these burgers that have been made, they have been processed and made to last for a long time. So they didn't make the burger when you got there. It was already made, probably frozen, and when you came, they thawed it and cooked it for you. The processing includes the addition of salts, of course, and other things, but salt is a culprit as far as, or sodium, as far as blood pressure is concerned, and of course, blood pressure leading to kidney damage. So don't make that mistake of eating salt and thinking that it's fine, it's fine, it's fine, especially when your age is going up. We put on undue pressure, undue load on the kidneys. Remember, the kidney has filters that filter our bodies of excess salt. And so the more salt you eat, you are putting too much work on the kidneys. You got to make sure that they are taking some minerals out, some salt out, and diabetes is already hurting it. And so you don't want to be doing that. And if you are naturally also having or carrying the genes for hypertension, even the salt is just an addition on top of what you are already predisposed to, which many African American communities and African communities have. Most of us are predisposed to hypertension before you even started eating your salty foods genetically. And so when we talk about salt, we got to really be concerned. And it starts with getting out the processed foods. Try and eat foods that you have made. You bought from the fresh produce place, you cooked it yourself, adding less salt and eating it, rather than to have it all processed by somebody, potentially put in a can or at a restaurant, and you go and picking it up. I'm not saying don't eat at a restaurant, but if that's all you do, especially in the fast food joints, I don't want to mention their names, but the next time you go, just open up the list of the ingredients. They have it all on their website, and they will tell you how much calories, which increases your blood sugar, and then the sodium. And that will tell you that eating processed foods, it's not going to be your friend. It's definitely not going to be your friend. So that is something that we are all doing. And salt is also hidden in so many other places. Apart from the regular processed foods, if you talk about canned soups, those of you who like canned soups, you don't make your soup yourself, but there's a canned soup. They have hundreds of milligrams of sodium. Regular Campbell soup that we all know about, as well as other soup. It's not just that one. As long as it's canned, remember they got to put the sodium to preserve it, to keep it long on the shelf, to keep it staying fresh on the shelf. And so salt becomes your friend in that regard, and then after you eat it, it becomes your enemy. So just 1 cup of canned soup contains over 700 milligrams of sodium. 700 milligrams of sodium from just 1 cup of sodium. Of canned soup. So if you are drinking canned soup, you are eating all those big good stuff, all those processed stuff. You can take it to the bank. You are increasing your salt or sodium intake. As a result, you are making the mistake of destroying your kidneys down the line, whether or not you have diabetes. And if you have diabetes, it's even worse because you are speeding up the process much faster than anyone would do. And we definitely don't want that to happen. And then, what do we do then as an action to avoid this? Eat whole foods. If you are eating your leaves, nobody puts sodium in the leaf. You can put a dressing full of sodium, but the idea is that if you add something not processed, nobody is processing it and trying to make it stay fresh. So sodium becomes less. So use natural flavors also. So eat unprocessed foods as well as naturally flavored stuff, rather than to use the ones that are artificially made to make it taste sweeter and last longer. So choose herbs and fresh spices instead of salt, and select from frozen or fresh fruits instead of things that have been made for you and salted and preserved for you to eat. So that is the mistake that we are making. Let's move on to mistake number 4. Mistake number 4 is not drinking enough water. Oh, come on, man. That's another one that I like. Mistake number 4, not drinking enough water. Dehydration concentrates toxins and force them into the kidneys. So the kidneys begin to work harder because you are not hydrated enough. If you are not drinking enough water, remember the kidney is a filter. Basically, it's a bunch of filters put together and made into a ball. And if you are not drinking enough fluids, then of course you are making the mistake of not allowing your kidneys to work right. And by not working right, what it means is you're giving it too much work. How does a filter takes out the wrong stuff when there's no water coming out with this wrong stuff? So you need to be hydrated to avoid um, seeing or to avoid destroying or to avoid unduly burdening your kidneys just because you are dehydrated. So dehydration is really something that we use to destroy our kidneys. Now, that being said, we have to be careful because I'm not sure if it's going to be on my slide here, but uh, if you are let me just move on. If it doesn't show up, I will talk about it. So, how do you know you are dehydrated and how do you get yourself more fluidized? If your pee or your urine is dark, from the image that I'm showing right here, you see it should be the yellow. It should be the pale yellow. That is where you know that you are hydrated. Now, if it is darker and as it comes down all the way to, in fact, where my slide is saying dehydrated, you got dehydrated before you even got there. So that is really, really bad. It shouldn't. Your urine shouldn't be as bad. My slide maker couldn't make it right, but anything um, after the yellow, as you get into the I don't know what color to call it. It's still in the gold portion, but not the bright yellow. As you get there, you are being dehydrated. So if you are urinating and you see your urine is darker, it means you are dehydrated. Simple as that. You are dehydrated. It may not be immediately obvious because it's not seriously dehydrated, but you are towards dehydration portion. So always look to see that your urine is bright yellow, rather than dark yellow or very brown. I remember I used to work in a place and we shared a big bathroom, and when I knew some people would go to the restroom and not flush, and you go and you see the kind of pee or urine in the urinary bowl, you will wonder what those people have been drinking. Very dark brown urine. That is so not healthy. So not healthy. So you got to drink enough water to be able to, filter out the toxins. If you are not drinking enough water, you are concentrating the poisons, I should say, the toxins in your kidneys and then destroying your kidney as a result. So not only is your kidneys not really perfused, you don't have enough, good blood going there because you are dehydrated. But then the little that go there also contain concentrated amounts of toxins or poisons that the body has removed. So those are not a good place to be. So um, just to make matters short, make sure your urine is in the bright yellow area, not in the red or dark brown, and definitely not in the black. In fact, if you are in the dark brown and you are drinking enough fluids and it's there, you got to see a doctor because that would mean something is wrong. Or even in the bright red, that also shows that you are actually urinating blood, and you don't want blood to come from your urine as a result. So check your urine. Dark yellow urine equals what? That your kidneys are in stress. Dark yellow, dark yellow urine equals your kidneys are under stress. That is exactly what we want to say. And the next thing then is, how do you avoid that? You avoid that by hydrating, by drinking enough water. That is the action plan to avoid dehydration and to avoid kidney issues. Traditionally we say 6 to 8 glasses of water a day or 6 to 8 cups a day, right? That is what we know traditionally to be the normal. If you are doing that and your kidneys are still not beginning to clear out the dark urine, then there's something wrong. You got to talk to your doctor because it means that the water is really not getting there. Probably something else is also going on. The other thing then is also, see what I wanted to say earlier. Those with existing kidney disease, yes, may need fluid limits. Yes, if you already have kidney um, problems, if your kidneys have been compromised already, whether as a result of diabetes or long-standing hypertension, then you cannot follow that strict rule of doing 6 to 8 cups of water a day or glasses a day because you may be fluid restricted because your kidneys may not be able to pull up all the water from your body and excrete it. And so in that case, your doctor may tell you, hey, I don't do too much water or too much liquids because of the already existing kidney problems. So those are the only people who would definitely have to watch how much drink or how much water they intake. And then also drinking here, hydrating here doesn't mean you should be drinking soda or any sweetened beverage. I'm not talking about drinking juice. I'm not talking about drinking Fanta, drinking Coke, drinking Sprite. No, those are even worse. Those are even worse. I don't know if I have a slide about that. No, but before I go there, those are worse. So you do not drink liquid or sweetened beverages as a means of, um, talking about your hydration, saying that, oh, you want me to drink more water? As for me, it's too hard for me to drink water, so I would drink soda. Oh, I'll drink diet soda. No, that doesn't cut it. That's as worse as not drinking water because even the sugar also causes you to be dehydrated because the kidneys have to work to remove the sugar too before you pee. And so you are giving another work to the kidneys by drinking sodas and sweetened juices just because you want to be hydrated. So when I'm talking about hydration, I'm talking about drinking plain old water, nothing added. Maybe you could do a tea, no sugar added, or coffee, right? Not too dark coffee, nothing added. Those are hydration, liquids that you can use to hydrate. But I'm not talking about you drinking soda or apple juice or orange juice because it's liquid. No, or anything sugar added for that matter. That is even worse. So you don't want to be doing that. What you want to do is to drink plain old water. If you can't drink plain old water, you can add lemon to it to make it a different, or you can drink water in its forms, mineral water. Some people make it seltzer water. Anyhow, you can drink water without the sugar. That's what we're talking about here. So, not don't just think you are going to be using that excuse to be drinking soda or juice. Yeah, fruit juice is fruit, but no, you don't drink those because they are sugar laden, and you don't want that because that's eventually also going to hurt. All right. So with that being said, I think we can go to the next mistake, which is the last mistake. The last mistake that people make and that destroys their kidney is the medications they take. People take painkillers and also others take herbal remedies that may not have been recommended by their doctors. The painkillers here that we usually see is what we call the NSAIDs. And we have a video on NSAIDs. I use my grandmother's experience with NSAIDs to make a video. You can go on the channel and look for it. How she actually ended up with more long-standing hypertension because of the use of NSAIDs. One NSAID in particular that we call indomedicine. I used to buy for her. Unbeknownst to me, we were increasing her chance of blood pressure or hypertensive crisis, not knowing. And she was hypertensive until the day she passed, broken down by hypertension. And yet, because of her arthritis, we were just constantly buying indomedicine. Now, you may not have indomedicine readily as it is, as it used to be, but there is another one that is common now, ibuprofen or naproxen. And some people are every time they are sick, they are reaching out for Brufen, as it's called in some other places, or Aleve, or Advil, or naproxen, and they are also destroying their kidneys as a result. These NSAIDs, they actually reduce blood flow to your kidneys, where the filtration has to go. And by reducing blood flow to the kidneys, they are in itself destroying your kidneys. And then also, they prevent you from excreting the salt that you need to excrete. And so, you don't want to be doing painkillers just for painkilling sake. If you have pain, especially if you have hypertension or if you have diabetes, make sure you talk to your doctor or to your pharmacist just to make sure that you are doing the right one. Because doing the wrong pain medication can lead to painful consequences in the future. Come on, man, I think that rhymes. Yeah, doing the wrong pain medication all the time can lead to painful consequences. in the future, in fact, not too distant the future, you're going to be developing hypertension if you don't have hypertension, and then you're going to be destroying your kidneys if you don't already have kidney issues going on. And in particular, if you have hypertension and diabetes, you exponentially increase the rate at which you destroy those organs. Why? Because those medications, in and of themselves, are destructive to the kidneys. And then on top of your existing conditions that you're trying to manage, it makes things worse. So definitely do not just reach out for any pain medication just because it's a pain medication. Make sure that you are doing your due diligence, talking to somebody who knows what they're doing. A pharmacist, you go on the shelf and you want to grab something, show them and ask and tell them, this is what I have. I have hypertension. I have diabetes. Is this good for me? And they'll be able to guide you. Or talk to your doctor. If your doctor is readily available, you can talk to them and see if they agree to that. And if your doctor is giving you a medication and they don't know the full extent of your conditions, then you got to let them know that, hey, this is what I have. And then they'll be able to make that right decision. But for the most part, if you reach out to your pharmacist, they should be able to tell you as far as you tell them what you are dealing with in terms of your chronic diseases. So yes, ibuprofen, what do you call it, diclofenac, naproxen, and a few other things. Unless it's going in your eye for some surgery, those are very minor, in your blood, so those don't count. But I'm talking about taking it by mouth for arthritis or for pain. Make sure that you are discussing it with your pharmacist because you may be destroying your kidneys. Some people have destroyed their kidneys without hypertension, without anything, just by consistently doing these NSAIDs or ibuprofen, Aleve, naproxen, diclofenac, and the rest. These are the common ones. So if you are careful to ask, you will avoid even the ones that are not so common. And especially risky when combined with diabetes or hypertension or high blood pressure. If you are taking these and you have diabetes, you're making your case even worse. So that is number 5, mistake 5 that people have been doing. Now, how do we then become more safe with medications? I think I was ahead of the game. I already said, talk to your pharmacist, talk to your doctor if you can reach them. But the easiest people with access that you have access to is your pharmacist. They are readily available in the community health setting. You can ask them, just make sure you tell them, hey, I have diabetes. Hey, I have hypertension. Is this pain medication good for me? Or if you can reach your doctor, hopefully they know all your conditions, they'll be able to tell. Sometimes they will refer you, go back to the pharmacist and ask them about what you need to take. And so definitely do not just take, you make such decisions quickly because somebody said, oh, I have this pain, and anytime I work and I come back home, I'm struggling with this pain, back pain, this is the medicine I took and it was so good for me. And then they give you the name and you go and you buy the same thing, not knowing what other things are associated with it. So you don't just rush into buying such things just because somebody else have an anecdotal evidence that it worked for them. Yes, they work for pain, but in your case, they may be giving you some other problem which you don't want. That's where we are focusing on. Yes, there are other pain medications such as acetaminophen, or in the US we call it Tylenol. In other places they call it paracetamol. Those are safer in terms of hypertension and diabetes, rather than the brufens and ibuprofens and the diclofenac and the naproxens, which all work together against your blood pressure and your diabetes in that respect. So definitely make sure that you do not take those medications. All right. So now, with that being said, let's see what else we have on. So, medication action plan: avoid self-medication and herbals. Oh man, I almost forgot about the herbals. That is another huge one. Herbals. A lot of people just, again, the anecdotes. This herbal concoction helped me. In fact, I even stopped using my blood pressure medication because of these herbs. And then people follow suit and they stop drinking or taking their medications. The people who use those herbs may not have gone back to the doctors to check their renal function or their kidney function. They may not have gone back to the clinic or the hospital to check on their liver function test to see how their liver enzymes are being produced in their blood. So they may be destroying their kidneys and their liver, but having, some relief of some sort from that herb, and you hear it and you get order the same thing because it's also cheap, and you be taking it. I don't care where it is made. It could be made in China, it could be made anywhere. If you are not following through with your doctor to check on your levels as far as um, your your liver function and your kidney function is concerned, and even your blood pressure and cholesterol levels are, you cannot just depend on such things and say that they are good because somebody said it's good. They are anecdotes. They don't have a full spectrum of the side effects that you may be experiencing. Some of them mild, like I'm saying, if you have the beginnings of kidney disease, you may not even feel it. If you have the beginnings of hypertension, you may not even feel it. So those herbals may not be your friend. In fact, they are not your friend because of the hidden threat of kidney damage and the rest that may come with it. So I definitely do not make that mistake of taking anything just because somebody says it's good for them. They may have good intentions. To be honest, people have good intentions. Even the people who make of polished juice, they have good intentions. But good intentions is not enough in medicine. In medicine, you have to have good intentions and you have to have evidence. And the evidence should not just include, anecdotes of it solving a problem, but it should also include, evidence of not hurting you in other respect. So if you are going to stop your diabetes medicine because somebody showed you some leaves, some concoction that works, okay, before you do that, make sure there are lab works that are also showing that your kidney function and your liver function are also intact while taking that. That is when you know that it is safe because you cannot just take anything to the bank when it comes to these things. And so, much as they have good intentions, you definitely need to ensure that you are not just taking anything that anybody recommends. Yes, they may recommend it. Of course, you can be nice about it and say, oh, really? Let me see. Talk to your doctor. And when you start taking it, let the doctor do lab work to see if everything else is in place. Even not just once. Because in regular conventional medicine, when we give you metformin for diabetes, we don't just throw metformin and say take metformin. We do lab work. In fact, sometimes we even have to do a lab test to see your what we call creatinine clearance or serum creatinine to see that your body, your kidneys are functioning fine before we give it to you. And then while on it, in a few months, we also have to test to make sure that it's not causing any harm. So you can't just grab any leaf concoction from anywhere and say that, oh, this one everybody knows it works for diabetes. It may, but what is the other side? What else is going on? The fact that you don't feel pain doesn't mean it's not doing harm. And so if you can ascertain the fact that it is safe in terms of your liver function, your kidney function, and other tests, then if it is good, you could take it. But frequently we don't do those labs. We just take them by anecdotes, and we take them without our doctors even knowing, our pharmacists even knowing. And on top of them, we take it sometimes with the medications that are given to us, conventional medicine, and that doesn't all go well because drug interactions will also set in. All right, so enough of that. I just want to make sure that people do not just, take anything for taking sake, especially if it is something that has not been prescribed. It is not enough. All right. So, what is? I think we were on the last point here, on the last, uh, yeah, the last mistake, which is not taking anything over the counter without your pharmacist or your doctor reviewing it as against your conditions. Right now, your kidneys are the silent heroes which are at risk if you do not do the right things. Silent doesn't mean it is safe. Oh, I think I alluded to that. The fact that the kidney is not saying anything doesn't mean it is safe. Small mistakes today can actually lead to dialysis tomorrow. And trust me, if you know anybody who's on dialysis, which is a procedure for people to undergo filtration of their blood so that they can get all their uh, the uh, the toxins removed, excesses removed from their blood because their kidneys are not working properly enough. When you see what they go through, some people have to go to a facility 3 times a week. Other people twice a week, just to make sure that they are having normal level. Normal life. You don't want to get there just because your kidney is silent. You can do anything, or you are not watching your diabetes. You're not watching your blood pressure. You don't want to get there. In some places, they don't even have those facilities for you to go. In places that I know, there are not enough places to go and be dialyzed. And so even when your kidney is shut and you cannot dialyze, eventually after this you die because there's not enough there. And people who have access to dialysis, it's not fun. And so let's watch our, our life and avoid those mistakes that we are talking about because it's not easy. Now, to protect your kidneys today, what you need to do is to watch two things we focused on, which is your blood pressure and your blood sugar. These two things work together to either make or unmake your kidney health. Okay? We already alluded to how you should bring your blood pressure down, how you should bring your blood sugar down. If you have enjoyed this live, our 2000 subscription live show, and you are watching us and you have not subscribed, make sure you subscribe. Like it, click the like or thumbs up button, and share with someone who has diabetes or hypertension, or even anybody who doesn't have it, but you want them to protect themselves. And also comment below and tell us some of the 5 mistakes that actually surprised you. You may have heard some of them before, but is there anyone that we mentioned? There's a lot more mistakes that people do, but we just have 5 for now. And hopefully, these 5, you have found one at least that you're going to avoid. But if all 5 are things you are doing, you know, against your body, then I challenge you to look into your life and make those necessary changes so that you protect your kidneys over the long haul. So that is where I will hitch the tent today, and I want to